When we went to buy our last round of new scanners, we found that there is significant advances with the Siemens definition class scanners. At Methodist Hospital, we have a very busy intervention department. We'll do on an average of 5 CT intervention cases on a day. And so efficiency is a very important aspect of our CT scanner and how we do interventional procedures. The interventional package they offer adds a number of very useful features. Siemens has worked very hard on reducing the dose for general diagnostic scans. You get dose savings not only from the applications during the spirals, where, for instance, it cuts off the beginning and end of the spiral radiation scatter, but it also helps you because it has modes that are inherently less dose. There are also several settings in the system that allows me to lower the dose on a scan. With eye control, I have the ability to run the scanner, make changes, and also review images from tableside. This becomes very important when doing a scan and allowing me to use the advanced features. In the older scanners, where you would only obtain a few axial images, there wasn't a whole lot of change that you'd want to make. But now that the scanner offers a wealth of new modes where there are dose savings, modes where you can achieve 3D imaging, now you want that control at the tableside so that you can do it yourself. The scanner now does more than just your standard 2D imaging. It takes advantage of real multi-slice capability, makes on-the-fly 3D multiplanar images, which gives you a whole new way to look at your needle path when you're doing a procedure. And this makes it faster and just overall makes doing interventions much easier. The scanner itself offers a lot of benefits to the patient. First of all, it has a large diameter bore, and this is important for patient comfort, but also for patient access. It allows me to perform procedures that might have previously been very difficult or nearly impossible to perform. It also allows for the patient to be in a much more comfortable position during the procedure. The experience is much like reading multi-slice CT on a workstation when you're doing a CT angiogram. You suddenly now have the same sort of tools at your fingertips when doing an intervention, and they come up almost immediately after the scan's done. The eye control system offers me a fair amount of flexibility on how the images are displayed. There is the ability to change layouts on the fly very easily between standard 3D layouts and user-defined layouts that put the images exactly where I want them and what I'm used to. This allows me not only to look at the current study, but I can also go backwards and review previous acquisitions. Having the best imaging tools at my fingertips is really the best way to get the exam done. So, for instance, having 3D capabilities of the definition class intervention system allows me to very easily do procedures and do them faster compared to older style scanners. Since we purchased the Siemens Definition 64-slice CT scanner, we've noticed a significant improvement in our interventions in that our doses to our badges have decreased significantly since our previous vendor. We've also noticed that our procedure time is about half what it was on the previous scanner, owing to better workflow efficiency and easier imaging during the case. I like Siemens as a vendor because my experience with them shows they have advancements that I can put into clinical use. Machines that I've had from Siemens in the past have had very useful upgrades, allowing me to do more complicated procedures or have better guidance, that sort of thing. So Siemens has a good track record of adding enhancements to existing products. And since you tend to own a product for a few years, it's important not only to have a product that's got a lot of capability on day one, but that really will grow with you over time as new capabilities are added.